Imagine a world where your health is not determined by your wealth. Picture a society where the accident of your birth, your zip code, your family's income, or the color of your skin does not dictate whether you live a long, healthy life or struggle with preventable illness. Imagine waking up each day knowing that, no matter what happens, you and your loved ones will have access to the care you need when you need it, without fear of losing your home or your savings. A world where getting sick does not mean facing financial ruin, where a diagnosis is met with compassion and support, not anxiety over how to pay for treatment. In this world, families do not have to choose between buying groceries and filling a prescription, or between paying rent and seeing a doctor. The fear of medical debt, which haunts millions, is replaced by a sense of security and shared responsibility. This is not a distant dream or a utopian fantasy. It is a vision grounded in the real experiences of people and communities who have dared to imagine something better and have begun to build it. Around the world, there are places where this vision is already taking shape, where the right to health is recognized and protected, and where the well-being of every individual is seen as a collective good. It is a tangible goal that nations around the globe are striving to achieve. From bustling cities to remote villages, from wealthy countries to those with fewer resources, the movement toward universal health coverage is gaining momentum. Governments, communities, and individuals are coming together to reimagine what healthcare can and should be. We stand at the dawn of a new era in healthcare with Peaceism Ecosystem, a time of unprecedented challenges but also incredible opportunities. The world is changing rapidly. Technological advances, demographic shifts, and global crises are reshaping the landscape of health and medicine. Yet with these changes comes the chance to build something better, to address the shortcomings of the past and create a future where health is a universal right. The conversations we're having today about how we care for one another are shaping the very fabric of our future societies. These discussions are not just about medicine or policy, they are about our values, our priorities, and our vision for the world we want to live in. They challenge us to think beyond the status quo, to ask what it truly means to care for our neighbors, and to recognize that our health is deeply interconnected. For too long, high-quality medical care has been a privilege, accessible only to those who could afford it. The gap between the haves and have-nots has grown wider, with millions left behind simply because they lack the means to pay. This inequality is not just a matter of dollars and cents. It is a matter of life and death, of dignity and justice. But a powerful idea is taking hold, that healthcare is a fundamental human right, not a commodity. This idea is being championed by people from all walks of life: patients, doctors, nurses, activists, and policymakers. It is a call to action, a demand for justice, and a recognition that our collective well-being depends on the health of each and every one of us. The recent global health crises have taught us a harsh but vital lesson. When a pandemic strikes, it does not discriminate based on income, nationality, or social status. It exposes the vulnerabilities in our systems and reminds us that, in the face of illness, we are all connected. The suffering of one becomes the risk of all. We learned that our health systems are interconnected, just as we are. A virus that emerges in one corner of the world can travel across continents in a matter of days, affecting millions. Our ability to respond depends not just on the strength of individual countries, but on our willingness to work together, to share knowledge, resources, and responsibility. A virus in one corner of the world can impact every single one of us. The health of a traveler, a neighbor, or a stranger halfway across the globe can have direct consequences for our own families and communities. This reality has shattered the illusion that we can isolate ourselves from global health threats. This shared vulnerability has exposed the deep cracks in our healthcare infrastructure. Underfunded hospitals, overworked staff, and outdated systems have struggled to keep up with the demands of crisis. The pandemic has revealed the consequences of neglecting public health, of treating healthcare as an afterthought rather than a cornerstone of society. It has shown us that a system that leaves some behind ultimately leaves everyone at risk. When care is rationed, when prevention is ignored, and when the most vulnerable are forgotten, the entire community suffers. The health of each individual is bound to the health of all. We are now forced to ask ourselves difficult questions. What kind of society do we want to be? Are we willing to accept a world where some lives are valued more than others? Or will we rise to the challenge of building a more just and compassionate system? These are not easy questions, but they are essential if we are to move forward. How can we build systems that are more resilient, more equitable, and more focused on the well-being of every individual? The answers will require innovation, investment, and a willingness to challenge old assumptions. We must design healthcare that can withstand future crises, that adapts to changing needs, and that puts people, not profits, at the center. The answer lies in rethinking our approach from the ground up, moving from reactive sickness care to proactive wellness promotion for all. This means investing in prevention, education, and community support. It means recognizing that health is shaped by more than just medical care. It is influenced by housing, nutrition, education, and the environment. This shift in thinking represents a monumental change in our priorities. It asks us to value long-term well-being over short-term profits, to measure success not just by the number of procedures performed, but by the health and happiness of our communities. It is a transformation that requires courage, vision, and collective action. It is about building a foundation of health for our communities. This foundation is not just physical, it is social, emotional, and economic. It is built on trust, on relationships, and on a shared commitment to the common good. It means ensuring that a child born in a remote village has the same chance at a healthy life as a child born in a bustling city. It means closing the gaps that divide us, between rich and poor, urban and rural, young and old. It means recognizing that every life is precious and that our future depends on the health of all our children. It is about creating a safety net that catches everyone, providing peace of mind and security. When people know they are protected, they are free to pursue their dreams, to contribute to society, and to care for one another. A strong safety net is the foundation of a healthy, resilient, and prosperous nation. This journey is not just about doctors and hospitals. It is about the teachers who educate children on healthy habits, the social workers who support families in crisis, the community leaders who advocate for clean water and safe neighborhoods. It is about the countless individuals who work every day to make health a reality for all. It is about social justice, economic stability, and human dignity. Health is not just the absence of disease, it is the presence of opportunity, of hope, and of the freedom to live a full and meaningful life. When we fight for healthcare for all, we are fighting for a more just and compassionate world. By prioritizing universal and preventive care, we invest in our most valuable resource, our people. Healthy children are able to learn and grow. Healthy adults are able to work, create, and care for their families. Healthy communities are able to thrive, innovate, and build a better future for all. A healthy population is a productive population, an innovative population, and a happy population. When we invest in health, we unlock human potential. We create the conditions for prosperity, creativity, and resilience. We build societies that are not just wealthier, but wiser and more compassionate. In this essay, we will embark on a journey to explore this new frontier. We will trace the evolution of healthcare, from its earliest beginnings to the cutting-edge innovations of today. We will examine the challenges we face, the progress we have made, and the possibilities that lie ahead. We will look at the concept of universal healthcare, not as a political buzzword, but as a practical and achievable goal. We will explore the policies, partnerships, and innovations that are making universal care a reality in countries around the world. We will ask what it takes to build systems that are truly inclusive, sustainable, and effective. We will examine how different countries have successfully built systems that provide care for all their citizens. From Scandinavia to Southeast Asia, from Canada to Costa Rica, we will learn from the successes and setbacks of others. We will see that there is no one-size-fits-all solution, but that the principles of equity, solidarity, and shared responsibility are universal. We will delve into the power of preventive medicine, a strategy that focuses on stopping illness before it even starts. We will explore how investments in vaccination, nutrition, mental health, and lifestyle support can save lives, reduce costs, and build stronger communities. Prevention is not just a medical strategy, it is a social and economic imperative. And we will confront the critical, often overlooked issue of mental health, arguing for its rightful place at the core of our healthcare models. Mental health is health. The stigma and neglect that have surrounded mental illness for generations must be replaced by understanding, support, and comprehensive care. Our vision for the future must include the mind as well as the body. This is a story of hope, innovation, and the relentless pursuit of a healthier, At the very heart of the discussion about universal healthcare lies a simple yet profound principle. This principle is not just a matter of policy or economics, but a reflection of our deepest values as a society. It asks us to consider what kind of world we want to live in and what responsibilities we have to one another as fellow human beings. When we talk about healthcare, we are not just talking about doctors, hospitals, or insurance plans. We are talking about the basic conditions that allow people to live full, meaningful lives. We are talking about dignity, security, and the opportunity to thrive. The principle is that every single person, regardless of their background, deserves to be healthy. Health is not a privilege reserved for the wealthy, the powerful, or the lucky. It is a birthright, something that should be guaranteed to all simply by virtue of being human. Whether you are young or old, rich or poor, born in a city or a rural village, your health matters, your life matters, and the health of each individual contributes to the health of the whole community. This is not just a nice idea, it is a core tenet of human rights. The right to health is enshrined in international law and recognized by nations around the world. It is a principle that has been fought for by generations of activists, doctors, and ordinary people who refuse to accept a world where some lives are valued more than others. When we recognize health as a human right, we affirm the inherent worth of every person. The World Health Organization's constitution, established decades ago, states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. This declaration was not made lightly. It was born out of the devastation of war and the recognition that peace, security, and prosperity are impossible without health. The WHO's founding document is a testament to the idea that health is not just the absence of disease, but a state of complete physical, mental, and social well-being. It is a vision of a world where everyone has the chance to reach their full potential. This means that access to medical care should not depend on your income, your social status, or your ability to pay. It means that no one should have to choose between buying food and buying medicine, between paying rent and seeing a doctor. It means that the doors of hospitals and clinics should be open to all, not just those who can afford to walk through them. In a truly just society, healthcare is not a commodity to be bought and sold, but a shared resource that belongs to everyone. Your job, your race, your gender, your religion, none of these should determine whether you receive the care you need. Too often, we see disparities in health outcomes that reflect deeper inequalities in our society. People of color, immigrants, and marginalized communities are more likely to face barriers to care and to suffer from preventable illnesses. By affirming the right to health, we commit ourselves to closing these gaps and ensuring that everyone has a fair shot at a healthy life, or where you happen to live. Whether you are in a bustling city or a remote rural area, your access to healthcare should be the same. Geography should not be destiny when it comes to your health. Yet, in many parts of the world, people in rural or underserved areas struggle to find even basic medical services. They may have to travel long distances, wait for hours, or go without care altogether. This is not just a logistical problem. It is a moral one. It should be a given, a foundational pillar upon which a just and compassionate society is built. When we make health a right, we send a powerful message about who we are and what we value. We say that we are a community that looks out for one another, that refuses to leave anyone behind. We say that we believe in fairness, in solidarity, and in the idea that our fates are intertwined. When we treat healthcare as a right, we change the entire dynamic of how we approach it. No longer is it something to be rationed or denied based on ability to pay. Instead, it becomes a collective responsibility, a promise we make to each other that no one will be left to suffer alone. This shift in perspective has profound implications for how we design our healthcare systems, how we allocate resources, and how we measure success. It stops being a service that is bought and sold and instead becomes a public good, like education or clean water. Just as we do not ask people to pay for the air they breathe or the water they drink, we should not ask them to pay for the care that keeps them alive. Public goods are the foundation of a healthy, functioning society. They are the things we provide to everyone because we all benefit when everyone has access.
Think about it this way. We do not expect a child to pay for each day they attend public school. We recognize that education is essential, not just for the individual child, but for the entire community. An educated population is more innovative, more productive, and more capable of solving the challenges we face. We invest in public education because we know it pays dividends for everyone. We understand that an educated population benefits everyone. The same is true for health. When people are healthy, they are able to learn, to work, to care for their families, and to contribute to society. They are less likely to miss school or work, less likely to need expensive emergency care, and more likely to live long, fulfilling lives. The benefits of good health ripple outward, touching every aspect of our lives. Similarly, a healthy population is the bedrock of a strong economy and a stable society. When people are healthy, they can pursue their dreams, support their families, and build better futures. Businesses thrive when their workers are healthy and productive. Communities are stronger when their members are able to participate fully in civic life. Health is not just a personal matter. It is a public good that benefits us all. When people are healthy, they can work, they can innovate, and they can contribute to the progress of society. They can invent new technologies, start businesses, and create art. They can care for their children and elders, volunteer in their communities, and help those in need. Health is the foundation upon which all other achievements are built. They can participate fully in their communities, taking part in events, supporting local initiatives, and building the social bonds that hold us together. When people are healthy, they are more likely to vote, to volunteer, and to engage in the civic life of their communities. They are more likely to help their neighbors, to mentor young people, and to contribute to the common good. And they can care for their families without the constant fear of a medical bill wiping out their life savings. Too many families live with the anxiety that a single illness or accident could lead to financial ruin. Medical debt is a leading cause of bankruptcy in many countries, and it can have devastating effects on families and communities. By guaranteeing the right to health, we can lift this burden and give people the security they need to plan for the future.
This perspective challenges us to design systems that are inclusive by nature. It asks us to look beyond the needs of the majority and to consider the needs of those who are most vulnerable. It asks us to build hospitals and clinics that are accessible to people with disabilities, to provide care in multiple languages, and to ensure that everyone feels welcome and respected. It asks us to invest in prevention, in mental health, and in the social determinants of health that shape our lives from birth to old age. It means tearing down the barriers that prevent people from seeking care. These barriers can take many forms: financial, geographical, cultural, or bureaucratic. They can be as obvious as a high price tag or as subtle as a lack of transportation or childcare. They can be rooted in discrimination, stigma, or fear. Whatever their form, these barriers keep people from getting the care they need and deserve. These barriers can be financial, such as high costs and confusing insurance plans. For many people, the cost of care is simply out of reach. Even those with insurance may face high deductibles, co-pays, and uncovered services. The complexity of the system can be overwhelming, leading people to delay or forego care altogether. No one should have to navigate a maze of paperwork or worry about surprise bills when they are sick or injured. They can be geographical, with people in rural areas living miles away from the nearest clinic. In some places, there may be no doctors or nurses for hundreds of miles. Transportation can be a major barrier, especially for those without cars or reliable public transit. Telemedicine and mobile clinics can help, but they are not a substitute for a robust, accessible healthcare infrastructure. They can also be cultural, where certain groups may feel misunderstood or unwelcome within the healthcare system. Language barriers, lack of cultural competence, and discrimination can all make it harder for people to get the care they need. Trust is essential in healthcare, and it can only be built when people feel seen, heard, and respected.
A rights-based approach demands that we actively identify and dismantle these obstacles, ensuring that the path to good health is open and accessible to every single member of our society, from the youngest child to the oldest senior. This means listening to the voices of those who have been left out or left behind. It means investing in community health workers, in outreach programs, and in policies that address the root causes of poor health. It means holding ourselves accountable for the outcomes we achieve, not just the services we provide. And it means recognizing that health is not just the responsibility of doctors and nurses, but of all of us, policymakers, educators, employers, and citizens alike.
Therefore, the push for universal healthcare is more than just a policy debate. It is a test of our values, our priorities, and our willingness to stand up for what is right. It is a recognition that our health is bound up with the health of others, and that we are all better off when everyone has the care they need. Universal health care is not just about coverage or cost. It is about justice, equity, and the kind of society we want to build. It is a moral imperative. When we deny people access to care, we are not just making a policy choice, we are making a moral one. We are saying that some lives matter less than others, that some people are not worthy of the care they need to survive and thrive. But when we affirm the right to health, we say that every life is precious and that no one should be left to suffer or die for lack of care. It is a reflection of the values we hold as a global community. Around the world, people are coming together to demand healthcare for all. They are marching in the streets, organizing in their communities, and raising their voices for justice. They are reminding us that health is not just a personal matter, but a collective responsibility. When we stand up for the right to health, we are standing up for a better world. Do we believe in a world where a person's lifespan is determined by their bank account? Where the rich can buy the best care, while the poor are left to suffer? Or do we believe in a world where everyone has a fair chance to live a long, healthy, and productive life? These are the questions at the heart of the debate over universal health care. They are questions about justice, about fairness, and about the kind of future we want to create. Or do we believe in a world where everyone has a fair chance to live a long, healthy, and productive life? Imagine a society where no one has to worry about how they will pay for their medicine, where every child can see a doctor when they are sick, and where every elder can age with dignity and security. Imagine a world where health is not a source of anxiety or fear, but a foundation for hope and opportunity. By framing healthcare as a fundamental human right, we set a clear and powerful goal. We say that we will not rest until everyone, everywhere, has the care they need to live their best life. We commit ourselves to building systems that are fair, inclusive, and responsive to the needs of all. We recognize that this will not be easy and that there will be challenges along the way. But we also know that it is possible and that the rewards are worth the effort. We commit ourselves to building a world where the health and well-being of all people are protected and promoted, creating a legacy of compassion and equity for generations to come. The right to health is not just an aspiration, it is a call to action. It is a promise we make to ourselves and to each other, that we will do everything in our power to ensure that everyone has the chance to live a healthy, fulfilling life. Let us rise to this challenge, and let us build a future where health is truly a right for all. The call for better, more equitable healthcare is not new, but the urgency we feel today is unparalleled. For decades, people have marched in the streets, written to their representatives, and spoken out in community meetings, demanding a system that serves everyone, not just the privileged few. Yet despite these efforts, progress has often been slow, incremental, and sometimes even reversed. Now, however, we find ourselves at a unique moment in history, a moment when the cracks in our healthcare systems have become impossible to ignore, and the need for transformative change is clearer than ever before. We are living in a world at a crossroads, a moment in history defined by a series of interconnected global challenges. The world is more connected than ever before, with people, goods, and ideas moving rapidly across borders. But this interconnectedness also means that crises, whether they are health-related, economic, or environmental, can spread quickly and affect us all. From the bustling terminals of international airports to the remote corners of the globe, no community is truly isolated from the ripple effects of global events. The choices we make now will shape the health and well-being of generations to come. The COVID-19 pandemic acted as a global stress test for our healthcare systems, and many were found wanting. Hospitals were overwhelmed, medical staff stretched to their limits, and resources like ventilators and protective equipment became scarce. The world watched as even the most advanced healthcare systems buckled under the pressure, revealing vulnerabilities that had long been ignored or underestimated. The pandemic exposed not only the fragility of our infrastructure, but also the heroism and dedication of healthcare workers, who risked their own lives to care for others. It laid bare the stark inequalities that exist not just between countries, but within them. In some neighborhoods, access to world-class care was a given, while just a few miles away, families struggled to find even basic medical services. Rural clinics operated with outdated equipment and minimal staff, while urban hospitals faced endless lines of patients, many of whom had delayed seeking care due to cost or lack of insurance. The pandemic made it impossible to ignore the deep divides that persist in our societies. We saw firsthand how communities with limited access to care suffered disproportionately. Children waited for hours in crowded clinics, parents worried about affording treatment, and outreach nurses became lifelines for those unable to travel. The most vulnerable, those living in poverty, people of color, immigrants, and the elderly, bore the brunt of the crisis. Their stories remind us that healthcare is not just a policy issue. It is a matter of justice, dignity, and human rights.
This collective trauma served as a powerful wake-up call, forcing us to confront the fragility of our health infrastructure and the deadly consequences of inaction. Empty city streets and overwhelmed hospitals became symbols of a world brought to its knees by a microscopic virus. The images of ambulances lined up outside emergency rooms and nurses breaking down from exhaustion are seared into our collective memory. We learned, in the harshest way possible, that our health systems are only as strong as their weakest links.
Beyond the pandemic, we face a rising tide of chronic diseases. These are not sudden crises that make headlines, but slow-burning challenges that quietly erode the health of millions. Chronic illnesses like diabetes, heart disease, and cancer require ongoing care, support, and resources. They affect people of all ages, backgrounds, and walks of life, and their impact is felt not just by patients, but by families, communities, and entire economies. Conditions like diabetes, heart disease, and cancer are becoming more common around the world. As lifestyles change and populations grow, these diseases are no longer confined to wealthy nations. They are a global epidemic. In some countries, rates of diabetes have doubled or even tripled in a single generation. Heart disease remains the leading cause of death worldwide, and cancer diagnoses are rising steadily. These conditions require not just medical treatment, but education, prevention, and long-term support. These are often called lifestyle diseases, linked to factors like diet, physical activity, and stress. The modern world, with its fast food, sedentary jobs, and relentless pace, has created an environment where unhealthy choices are easy and healthy ones are hard. Stress, too, plays a major role. Chronic stress can weaken the immune system, raise blood pressure, and contribute to a host of health problems. But while individual choices matter, we must also recognize the role of social and economic factors in shaping our health. Unlike infectious diseases that can be treated with a short course of medicine, chronic illnesses require long-term management. Patients must learn to monitor their own health, manage complex medication regimens, and navigate a healthcare system that is often confusing and fragmented. For many, this is a lifelong journey, filled with challenges and setbacks. The burden of managing a chronic illness can be overwhelming, especially for those without strong support networks or access to affordable care. They place a continuous and growing strain on healthcare resources, and their financial cost to individuals and governments is staggering. Families are forced to make impossible choices between paying for medication and other essentials. Governments struggle to keep up with rising healthcare costs, diverting resources from other critical needs like education and infrastructure. The economic impact of chronic disease is measured not just in dollars, but in lost productivity, missed opportunities, and diminished quality of life. A system designed primarily to treat acute, short-term illnesses is simply not equipped to handle this slow-motion health crisis. Emergency rooms are built for trauma and sudden illness, not for the ongoing care that chronic conditions require. Patients with chronic diseases often fall through the cracks, receiving fragmented care from multiple providers, with little coordination or follow-up. The result is a system that is reactive rather than proactive, one that treats symptoms rather than addressing root causes. We need a new model, one that can manage long-term conditions effectively and affordably. This means embracing new technologies like telemedicine and remote monitoring that can bring care to patients wherever they are. It means investing in prevention, education, and community-based support so that people can stay healthy and independent for as long as possible. And it means rethinking the way we deliver care, breaking down silos and building teams that work together to support the whole person, not just their disease. At the same time, our global population is aging. Advances have extended life expectancy in many parts of the world. more people are living into their 70s, 80s, and beyond, enjoying years that previous generations could only dream of. This is a remarkable achievement and a testament to human ingenuity and progress. People are living longer than ever before, which is a testament to the successes of modern medicine and public health. We celebrate the stories of centenarians surrounded by family, of seniors graduating from new programs, and of older adults staying active and engaged in their communities. These stories inspire us and remind us of what is possible when we invest in health and well-being across the lifespan. However, an aging population brings its own unique set of healthcare needs. Older adults are more likely to live with multiple chronic conditions, require complex medication regimens, and need support with daily activities. The risk of cognitive decline, mobility issues, and social isolation increases with age, creating new challenges for families, caregivers, and healthcare providers alike.
Older adults are more likely to have multiple chronic conditions, often requiring care from several different specialists. This can make navigating the healthcare system especially challenging, as patients and their families must coordinate appointments, medications, and treatments across multiple providers. The complexity of care increases, and so does the risk of errors, miscommunication, and gaps in treatment. Require more frequent medical attention, including regular checkups, monitoring of vital signs, and adjustments to treatment plans. Preventive care becomes even more important, as early detection and intervention can make a significant difference in outcomes. But for many seniors, barriers like transportation, cost, and mobility issues make it difficult to access the care they need, and need support for mobility and daily living. Many older adults rely on caregivers, both family members and professionals, to help with tasks like bathing, dressing, and preparing meals. Physical therapists, occupational therapists, and home health aides play a vital role in helping seniors maintain their independence and quality of life. But the demand for these services is growing rapidly, and many communities are struggling to keep up. This demographic shift is putting immense pressure on healthcare systems and social care services. Hospitals and clinics are seeing more elderly patients with complex needs, while social services are stretched thin, trying to provide support for housing, nutrition, and mental health. Healthcare workers are facing heavier workloads, more paperwork, and higher rates of burnout. The challenge is not just to provide more care, but to provide better, more coordinated, and more compassionate care. If we do not adapt our models of care to better support the health and dignity of our elders, we risk a future where a growing segment of our population is left vulnerable and without adequate support. Social isolation, neglect, and inadequate care are already realities for too many seniors. Families worry about their loved ones, and communities struggle to provide the resources and services that are needed. The choices we make now will determine whether we rise to meet this challenge or allow it to overwhelm us.
This convergence of crises, the aftermath of a pandemic, the rise of chronic disease, and the reality of an aging population creates an undeniable imperative for change. We are at a tipping point where the old ways of doing things are no longer sufficient. The systems and structures that served us in the past are struggling to keep up with the demands of the present, let alone the challenges of the future. The need for innovation, investment, and bold leadership has never been greater. The old ways of doing things are no longer sufficient. We cannot afford to patch up a system that is fundamentally broken. Healthcare workers are frustrated and exhausted, patients are waiting longer for care, and outdated equipment and facilities are holding us back. Incremental fixes and temporary solutions are not enough. We need a comprehensive, forward-thinking approach that addresses the root causes of our healthcare challenges. The cost of inaction, measured in both human lives and economic productivity, is simply too high. Every day that we delay, more people suffer needlessly, more families are pushed into poverty by medical bills, and more opportunities for prevention and early intervention are lost. The economic toll is staggering, with billions of dollars lost each year to preventable illness, disability, and premature death. But the human cost, the pain, the fear, the loss of dignity, is even greater. This is our moment to be bold, to learn from our past mistakes, and to build something better. We have the knowledge, the technology, and the creativity to reimagine healthcare for the 21st century. By working together, across disciplines, sectors, and borders, we can create systems that are more resilient, more equitable, and more responsive to the needs of all people. The challenges are great, but so are the opportunities. It is the time to design and implement healthcare systems that are resilient, sustainable, and truly universal, ensuring they can meet the challenges not just of today, but of tomorrow. We must build on the lessons of the past, embrace new ideas, and commit to a future where everyone has access to the care they need, when they need it. The world is watching, and the stakes could not be higher. The decisions we make now will shape the health and well-being of generations to come. The crossroads is before us. The time to act is now. There is an old saying, an ounce of prevention is worth a pound of cure. This phrase, though simple, carries a profound truth that echoes through generations. It reminds us that taking small, thoughtful steps today can spare us from much greater hardship tomorrow. In the world of health, this wisdom is more relevant than ever. Imagine a world where we don't just wait for illness to strike, but instead, actively work to keep ourselves and our communities healthy from the very beginning. This simple wisdom holds the key to transforming our entire approach to health. It challenges us to rethink the way we view medicine, not as a last resort, but as a continuous journey of care, vigilance, and empowerment. When we embrace prevention, we shift our focus from crisis management to long-term well-being, from reacting to problems to anticipating and averting them. For too long, our medical systems have been built around a reactive model. Hospitals and clinics are often designed to respond to emergencies, to treat diseases after they have already taken hold. The sight of ambulances rushing to hospitals, emergency rooms filled with patients, and doctors working tirelessly to save lives is all too common. While this work is vital, it is only one part of the story. We wait for people to get sick, and then we mobilize our vast resources to treat their illness. This approach, while necessary in many cases, often means that we are always one step behind. We are constantly playing catch-up, trying to repair damage that might have been prevented in the first place. This is what we call sick care. It is a system that is reactive by nature, focused on treating symptoms and managing crises. While sick care saves lives and alleviates suffering, it is not enough on its own. It is like patching holes in a sinking ship, rather than fixing the leak at its source. It is incredibly important, but it is also incredibly expensive and often comes too late. The costs of hospital stays, surgeries, and advanced treatments can be staggering, not just in terms of money, but also in terms of human suffering and lost potential. For many families, a single illness can mean financial hardship, emotional distress, and a long road to recovery.
Preventive care flips this model on its head. Instead of waiting for problems to arise, it encourages us to take action early and often. It is about building a culture of health, where regular checkups, healthy habits, and early interventions are the norm. Imagine visiting your doctor not just when you're sick, but as a routine part of staying well. It focuses on keeping people healthy in the first place, stopping diseases before they have a chance to take root. Vaccinations, screenings, and lifestyle counseling are all tools in the preventive care toolkit. By identifying risks early, we can intervene before minor issues become major health crises. It is the ultimate form of proactive, forward-thinking medicine. Preventive care is about using the best of our knowledge and technology to safeguard our health, not just restore it. It means harnessing data, research, and community resources to create a safety net that catches problems before they fall through the cracks. Preventive care encompasses a wide range of strategies. It is not a single intervention, but a comprehensive approach that touches every stage of life. From childhood immunizations to adult cancer screenings, from nutrition education to mental health support, prevention is woven into the fabric of a healthy society. It includes routine checkups and screenings that can catch problems early when they are easier and cheaper to treat. A simple blood test can reveal hidden risks. A mammogram can detect cancer before symptoms appear, and a blood pressure check can prevent a heart attack. Think of mammograms to detect breast cancer, blood pressure checks to prevent heart attacks, and vaccinations to stop infectious diseases from spreading. These are not just medical procedures, they are acts of foresight, investments in a healthier future. Each one represents a chance to change the course of someone's life for the better. It also involves promoting healthy lifestyles. Prevention is not just about what happens in the doctor's office, it's about the choices we make every day. Eating nutritious foods, staying active, managing stress, and getting enough sleep are all part of the equation. This means educating people about the importance of a balanced diet, regular exercise, and avoiding harmful habits like smoking. Public health campaigns, school programs, and community workshops all play a role in spreading this message. When people understand the impact of their choices, they are empowered to take control of their health. It is about creating environments that make healthy choices the easy choices, such as building more parks and ensuring access to affordable fresh food. When neighborhoods have safe places to walk, bike, and play, and when healthy foods are available and affordable, it becomes much easier for everyone to live well.
The benefits of prioritizing prevention are enormous. When we invest in keeping people healthy, we see the rewards ripple through every aspect of society. Healthier people mean stronger families, more vibrant communities, and a more resilient nation. From a human perspective, it is obviously better to avoid getting sick than to endure treatment and recovery. The peace of mind that comes from knowing you are doing everything you can to stay healthy is invaluable. It means more time spent with loved ones, more opportunities to pursue your passions, and fewer days lost to illness. It means less pain, less suffering, and a higher quality of life for individuals and their families. Children can grow up strong and active, parents can provide for their families, and grandparents can enjoy their golden years with vitality and independence. From an economic perspective, the numbers are just as compelling. Preventive care is not just good for our health, it is good for our wallets. Every dollar spent on prevention can save many more dollars down the line by avoiding costly treatments and hospitalizations. Treating advanced diseases like late-stage cancer or managing the complications of uncontrolled diabetes is astronomically expensive. These conditions often require long hospital stays, complex medications, and ongoing care that can strain even the most robust healthcare systems. By investing a smaller amount of money upfront in prevention and early detection, we can save billions of dollars in future healthcare costs. These savings can be redirected to other critical needs, such as improving education, infrastructure, or social services. This frees up resources that can be used to improve other areas of the healthcare system or society as a whole. When we spend less on treating preventable diseases, we have more to invest in research, innovation, and the well-being of our communities. Ultimately, a focus on preventive care is an investment in a nation's future. It is about building a foundation for generations to come, where health is not a privilege, but a right enjoyed by all. Healthy children learn better in school. When kids are well-nourished, active, and free from preventable illnesses, they are more likely to succeed academically and socially. This sets the stage for a lifetime of achievement and fulfillment. Healthy adults are more productive at work and more engaged in their communities. They can contribute their talents, energy, and creativity to building a better world. When people are not burdened by chronic illness, they are free to pursue their dreams and support those around them. Healthy seniors can continue to live independently and contribute their wisdom and experience. They can remain active members of their families and communities, sharing their knowledge and enriching the lives of those around them. By shifting our focus from sickness to wellness, we build a stronger, more resilient society from the ground up. Prevention is not just a medical strategy, it is a social movement, a commitment to caring for one another and creating a brighter future for all. It is the difference between constantly fixing a leaky roof and building a sturdy, well-maintained house that can withstand any storm. When we invest in prevention, we are not just patching up problems, we are creating lasting solutions that protect us for years to come. Preventive care is that strong foundation upon which a truly effective and sustainable healthcare system must be built. It is the thread that weaves together individual well-being, community strength, and national prosperity. By choosing prevention, we choose a future where health is not just the absence of disease, but the presence of vitality, opportunity, and hope for everyone. For generations, we have treated the mind and the body as two separate entities. This idea, deeply rooted in our history, has shaped not only our personal beliefs, but also the very foundations of our healthcare systems. The ancient Greeks, for example, believed that the mind and body were distinct, and this dualistic thinking has echoed through centuries of medical practice. Even as science advanced and our understanding of the human body grew more sophisticated, the mind was often left behind, regarded as mysterious, intangible, and somehow less real than the physical body. We built a healthcare system that was incredibly sophisticated at treating physical ailments: a broken bone, a heart condition, an infection. Our hospitals became temples of healing for the body, equipped with the latest technology and staffed by highly trained professionals. We celebrated medical breakthroughs that cured diseases, repaired injuries, and extended life expectancy. When someone was physically hurt, there was a clear path to care: diagnosis, treatment, recovery. The process was visible, measurable, and most importantly, accepted by society as necessary and urgent. But when it came to the health of our minds, we often fell silent. The language of mental health was rarely spoken in public. People who struggled with their thoughts or emotions were left to navigate their pain alone, often without guidance or support. The spaces dedicated to mental health care were hidden away, their doors closed to the outside world. For many, seeking help felt like an admission of failure, a secret to be kept rather than a step toward healing.
Mental health conditions like depression, anxiety, and trauma were treated not as real illnesses, but as personal weaknesses or even moral failings. People were told to snap out of it, to be strong, or to just think positive. Instead of compassion, they were met with judgment. Instead of support, they faced skepticism. This misunderstanding was not just a personal issue, it was institutional. Schools, workplaces, and even healthcare providers often failed to recognize the seriousness of mental health struggles. They were shrouded in stigma and shame, forcing millions to suffer in isolation. The fear of being labeled or misunderstood kept people from reaching out. Even when help was available, the barriers, social, financial, and emotional, were often too high to overcome. The result was a silent epidemic, with countless individuals hiding their pain behind a mask of normalcy, afraid to let anyone see their struggle.
This artificial separation has created a silent pandemic of mental illness, a crisis that has been ignored for far too long and has devastating consequences for individuals, families, and societies. The impact is not just emotional, it is physical, economic, and generational. When mental health is neglected, the effects ripple outward, touching every aspect of life. Relationships suffer, productivity declines, and communities become fractured. The cost of inaction is measured not only in dollars, but in lost potential, broken families, and lives cut short.
The reality is that mental health is health. It is not a separate category, not an afterthought, but a fundamental part of our overall well-being. Just as we would never ignore a broken bone or a high fever, we cannot afford to ignore the signs of mental distress. The brain is an organ, just like the heart or the lungs, and it deserves the same level of care and attention. There is no health without mental health. This is not just a slogan, it is a scientific fact. Our thoughts, emotions, and behaviors are deeply intertwined with our physical health. When our minds are unwell, our bodies suffer. When our bodies are sick, our mental health is at risk. The two cannot be separated, no matter how hard we try. Our mental well-being is intrinsically linked to our physical well-being. Studies have shown that people who maintain strong social connections, engage in regular physical activity, and practice mindfulness are not only happier, but also healthier. The mind and body work together, each influencing the other in ways we are only beginning to fully understand.
Untreated depression can worsen the outcomes of heart disease and diabetes. When someone is struggling with their mental health, they may find it harder to follow medical advice, take medications, or maintain healthy habits. This can lead to complications, hospitalizations, and even premature death. The connection is clear. Caring for the mind is essential to caring for the body. Chronic stress can weaken the immune system, making us more susceptible to physical illness. Stress hormones like cortisol, when elevated for long periods, can damage the body's ability to fight off infections, heal wounds, and regulate inflammation. Over time, this can contribute to a host of health problems, from frequent colds to serious conditions like hypertension and autoimmune diseases.
And, conversely, living with a chronic physical condition can take a significant toll on a person's mental health. The daily challenges of managing pain, medication, and limitations can lead to feelings of frustration, hopelessness, and isolation. For many, the emotional burden of illness is as heavy as the physical one, and without support, it can become overwhelming. To ignore one is to fail to properly care for the other. True healing requires us to see the whole person, not just a collection of symptoms. When we treat only the body, we miss the underlying causes of suffering. When we treat only the mind, we overlook the physical realities that shape our experiences. Integration is not just ideal, It is essential.
We must break down the artificial wall between mental and physical care and embrace a holistic view of human health that acknowledges this fundamental connection. This means reimagining our healthcare systems, training our providers, and educating our communities. It means creating spaces where people feel safe to talk about their mental health, just as they would about a broken arm or a persistent cough.
The scale of the mental health crisis is staggering. In every city, every town, and every rural community, people are struggling, often in silence. The pressures of modern life, from economic uncertainty to social isolation, have only intensified the need for mental health support. The COVID-19 pandemic, for example, brought these issues into sharp focus, revealing just how vulnerable we all are to stress, anxiety, and depression. The World Health Organization estimates that nearly 1 billion people worldwide are living with a mental disorder. That is 1 in every 8 people on the planet. These numbers cut across age, gender, race, and nationality. Mental health challenges do not discriminate. They affect the young and the old, the rich and the poor, people in every corner of the globe. The economic cost, in terms of lost productivity and healthcare expenditures, is measured in the trillions of dollars. Businesses lose valuable employees to burnout and mental illness. Healthcare systems are strained by the consequences of untreated mental health conditions, which often manifest as physical problems. The ripple effects are felt in every sector of society, from education to law enforcement to social services.
Yet, the human cost is immeasurable. Behind every statistic is a person, a parent, a child, a friend, whose life has been touched by mental illness. The pain is not just individual, it is shared by families, friends, and entire communities. The loss of joy, the strain on relationships, the dreams deferred or abandoned, these are costs that cannot be calculated. It is the parent who cannot get out of bed to care for their children. The exhaustion is not just physical, it is emotional, mental, and spiritual. The guilt and shame compound the suffering, making it even harder to ask for help. Children, in turn, may feel confused, scared, or even responsible for their parents' pain. It is the student who cannot concentrate in school due to overwhelming anxiety. The pressure to perform, to fit in, to meet expectations can be crushing. For some, the classroom becomes a place of fear rather than learning. Without support, these struggles can lead to academic failure, social withdrawal, and long-term consequences for self-esteem and future opportunities. It is the veteran haunted by the trauma of conflict. The memories of war, loss, and violence do not fade easily. Many veterans return home with invisible wounds, post-traumatic stress, depression, anxiety, that can be just as debilitating as any physical injury. Too often, they face these battles alone, unsure where to turn for help.
These are not niche issues. They are universal human experiences that touch every community in every country around the world. No one is immune to the challenges of mental health. Whether it is a temporary struggle or a lifelong condition, everyone deserves understanding, support, and access to care. The universality of mental health reminds us of our shared humanity and our collective responsibility to care for one another.
This is why any meaningful conversation about revolutionizing healthcare must place mental health front and center. We cannot afford to treat it as an afterthought or a luxury. It must be woven into the fabric of our healthcare systems, our policies, and our everyday lives. Only then can we hope to address the true scope of the crisis and begin to heal as individuals and as a society. It is not enough to simply add a few psychological services as an afterthought. We must redesign our clinics, hospitals, and community centers to make mental health care accessible, visible, and valued. This means investing in infrastructure, hiring more mental health professionals, and ensuring that services are available to everyone, regardless of income or background.
We must fully integrate mental health care into our primary care systems. This means that every doctor, nurse, and healthcare worker should be equipped to recognize and respond to mental health needs. It means breaking down silos between specialties and fostering a culture of collaboration. When mental and physical health professionals work together, patients receive more comprehensive, effective care. This means training.
As we confront the immense challenges of providing universal, preventive, and holistic care, we find ourselves armed with a powerful new ally technology. The digital revolution that has transformed so many aspects of our lives is now poised to reshape the landscape of healthcare.
From telemedicine to wearable sensors to powerful data analytics, new tools are emerging that can help us bridge the gaps in our current systems. Technology holds the promise of making healthcare more accessible, more personalized, and more efficient than ever before.
It can help us overcome old barriers of distance and cost, bringing care directly to the people who need it, wherever they may be. Consider the impact of telehealth. Not long ago, seeing a doctor required taking time off work, traveling to a clinic, and sitting in a waiting room. For people in rural areas or those with mobility issues, this could be a significant obstacle to care.
Today, a patient can connect with a specialist hundreds of miles away through a simple video call on their smartphone. This technology is a game changer for providing routine consultations, follow-up appointments, and especially for expanding access to mental health services.
It makes care more convenient, reduces costs, and ensures that geography is no longer a primary determinant of a person's access to expertise.
Wearable devices, such as smartwatches and fitness trackers, are also playing an increasingly important role in the shift towards preventive health. These devices can continuously monitor vital signs like heart rate, sleep patterns, and physical activity levels.
They empower individuals to take a more active role in managing their own health, providing real-time feedback and encouragement. For doctors, this stream of data provides a much richer picture of a patient's health than a once-a-year checkup ever could.
It allows them to spot worrying trends early and intervene before a minor issue becomes a major health crisis, embodying the very essence of preventive medicine.
Furthermore, the ability to collect and analyze massive amounts of health data is opening up new frontiers in public health. By examining large-scale population health data, researchers and policymakers can identify emerging disease outbreaks much faster, understand the risk factors for chronic illnesses more clearly, and allocate resources more effectively.
This data-driven approach allows for more targeted and impactful public health interventions.
Technology is not a panacea, and we must be mindful of issues like privacy and digital equity. However, when harnessed responsibly, it offers an incredible toolkit for building the healthcare systems of the future. Systems that are smarter, more responsive, and truly centered around the patient. While today's technology is already impressive, we are on the cusp of an even greater transformation, one driven by artificial intelligence. The world of healthcare is about to experience a revolution that will touch every aspect of how we diagnose, treat, and prevent disease. Imagine a future where the boundaries between human expertise and machine intelligence blur, creating a partnership that is greater than the sum of its parts. This is not just a technological upgrade. It is a fundamental shift in the way we approach medicine, patient care, and even our understanding of health itself. AI is poised to become the invisible engine powering a new era of healthcare, one that is more precise, more efficient, and more compassionate than ever before. AI is not just about faster computers or more sophisticated software. It represents a new way of solving problems. It is about harnessing the power of data, pattern recognition, and machine learning to tackle challenges that have long seemed insurmountable. In healthcare, this means using AI to sift through mountains of medical records, research papers, and clinical data to find connections and solutions that would take humans years or even decades to uncover. It is about creating tools that can learn from experience, adapt to new information, and continuously improve their performance, just like a seasoned physician. But unlike any human, AI can work tirelessly, 24/7 without fatigue or bias, and with access to a global pool of knowledge.
In healthcare, AI has the potential to augment the skills of human doctors, accelerate medical research, and personalize treatment in ways we could once only imagine. Picture a world where every doctor has an AI assistant by their side, offering real-time insights, double-checking diagnoses, and suggesting the latest evidence-based treatments. Medical researchers can use AI to analyze vast data sets, uncovering patterns that lead to new discoveries and breakthroughs. For patients, AI means care that is tailored to their unique needs, preferences, and genetic makeup, rather than a one-size-fits-all approach. This partnership between human intuition and machine intelligence could lead to earlier detection of diseases, more effective therapies, and better outcomes for everyone. It promises to analyze complex medical information with a speed and accuracy that surpasses human capabilities, unlocking new insights that could revolutionize every aspect of medicine, from diagnosis to treatment to prevention. Imagine being able to process millions of patient records in seconds, identifying subtle trends and risk factors that would otherwise go unnoticed. AI can integrate data from a variety of sources: genetic tests, imaging scans, wearable devices, and even social determinants of health, to create a comprehensive picture of each patient. This holistic approach allows for more precise diagnoses, targeted therapies, and proactive interventions that can prevent illness before it starts.
This is not science fiction. It is the near future of healthcare. Hospitals and clinics around the world are already beginning to adopt AI-powered tools, and the pace of innovation is only accelerating. From smart hospital rooms that monitor patient vitals in real time, to AI-driven triage systems that prioritize care based on urgency and need, the transformation is underway. The integration of AI into healthcare settings is not just about technology, it is about reimagining workflows, empowering clinicians, and ultimately improving the patient experience. The future is arriving faster than we think, and it is bringing with it a new standard of care. One of the most exciting applications of AI is in medical imaging. For decades, radiologists have relied on their training and experience to interpret X-rays, Connecticut scans, and MRIs, searching for signs of disease hidden within complex images. But even the most skilled human eye can miss subtle abnormalities, especially when faced with a high volume of cases or fatigue. AI algorithms, trained on millions of annotated images, can now assist radiologists by highlighting areas of concern, measuring tumor sizes, and even predicting disease progression. This collaboration between human and machine is setting a new benchmark for accuracy and efficiency in diagnostic imaging. AI algorithms can be trained to analyze X-rays, Connecticut scans, and MRIs to detect signs of disease, such as cancerous tumors or the early indicators of diabetic eye disease. These systems learn from vast libraries of medical images, constantly refining their ability to spot patterns that may be invisible to the naked eye. For example, in oncology, AI can help identify tumors at an earlier stage, when they are most treatable. In ophthalmology, AI can screen for diabetic retinopathy, a leading cause of blindness, with remarkable accuracy. The result is faster, more reliable diagnoses that can make a life-changing difference for patients.
In many cases, these AI systems can spot abnormalities that are too subtle for the human eye to see, leading to earlier and more accurate diagnoses. This is especially important in conditions where early intervention can dramatically improve outcomes, such as cancer, stroke, or heart disease. By acting as a second set of eyes, AI can help reduce diagnostic errors, catch diseases in their earliest stages, and ensure that no detail is overlooked. For patients, this means greater peace of mind and a better chance at a full recovery. This does not replace the radiologist, it empowers them. AI serves as a collaborative partner, providing additional information and insights that enhance the expertise of medical professionals. Radiologists can focus on complex cases, patient communication, and decision-making, while AI handles the repetitive and time-consuming aspects of image analysis. This synergy allows for more efficient workflows, reduced burnout, and ultimately, better care for patients. The goal is not to automate away the human touch, but to free up clinicians to do what they do best: care for people. It acts as a tireless, incredibly precise second set of eyes, reducing errors, speeding up the diagnostic process, and ultimately allowing doctors to start life-saving treatments sooner, dramatically improving patient outcomes. In emergency situations, where every minute counts, AI can help prioritize cases, flag urgent findings, and ensure that patients receive the right care at the right time. Over time, as these systems continue to learn and evolve, their impact on healthcare will only grow, setting new standards for safety, quality, and efficiency.
AI is also set to revolutionize the world of drug discovery and development. The process of creating new medications has always been a complex, time-consuming, and expensive endeavor. Researchers must sift through countless chemical compounds, run endless experiments, and navigate a maze of regulatory hurdles. The odds of success are slim, and the costs are astronomical. But with AI, we have the potential to change this equation, making drug discovery faster, more efficient, and more targeted than ever before. The process of bringing a new medication to market is notoriously long, expensive, and fraught with failure. On average, It takes more than 10 years and billions of dollars to develop a single new drug, with most candidates failing somewhere along the way. This slow pace means that patients often have to wait years for new treatments, and many promising ideas never make it out of the lab. The traditional approach is simply not sustainable in a world where new diseases and health challenges are emerging all the time. It can take over a decade and cost billions of dollars. The financial and human costs are staggering, and the need for innovation has never been greater. Every delay in drug development means lives lost, suffering prolonged, and opportunities missed. The pressure is on to find new ways to accelerate the process, reduce costs, and bring life-saving therapies to patients faster. AI can accelerate this process dramatically. By analyzing massive data sets of chemical structures, biological pathways, and clinical outcomes, AI can identify promising drug candidates in a fraction of the time it would take traditional methods. Machine learning models can predict how a compound will interact with the human body, flag potential side effects, and even suggest modifications to improve efficacy and safety. Automated systems can run virtual experiments, testing thousands of hypotheses in silico before a single test tube is touched. This approach not only speeds up discovery, but also reduces the risk of costly failures down the line.
By analyzing vast databases of genetic, molecular, and clinical data, AI algorithms can identify promising drug candidates, predict how they might work in the human body, and even help design clinical trials more efficiently. This means that researchers can focus their efforts on the most promising leads, reducing wasted time and resources. AI can also help identify patient populations that are most likely to benefit from a new therapy, enabling more targeted and effective clinical trials. The result is a faster, more efficient path from discovery to approval, with better outcomes for patients and lower costs for healthcare systems. This could lead to a new era of personalized medicine, where treatments are tailored not just to a disease, but to an individual's unique genetic makeup. Imagine a world where your doctor can prescribe a medication that is custom designed for your specific biology, maximizing effectiveness and minimizing side effects. AI can help identify genetic mutations that drive disease, predict how you will respond to different therapies, and even suggest lifestyle changes that can improve your health. This level of personalization has the potential to transform the way we think about medicine, shifting the focus from treating illness to optimizing wellness.
Beyond diagnosis and treatment, AI will be a cornerstone of proactive, preventive health. The future of healthcare is not just about curing disease, but about keeping people healthy in the first place. AI can help identify risk factors, predict who is most likely to develop certain conditions, and recommend interventions that can prevent illness before it starts. This shift from reactive to proactive care has the potential to save lives, reduce costs, and improve quality of life for millions of people. Imagine an AI-powered system that continuously analyzes your health data from wearable devices, your electronic health records, and even your genetic profile. This system could monitor your heart rate, sleep patterns, activity levels, and more, looking for early signs of trouble. It could compare your data to millions of others, identifying patterns and trends that might indicate a developing problem. By integrating information from multiple sources, AI can provide a more complete picture of your health, helping you and your doctor make better decisions.
This system could identify your personal risk factors for various diseases and provide you with highly customized recommendations for diet, exercise, and lifestyle changes to keep you healthy. For example, if your genetic profile suggests a higher risk for heart disease, the AI could recommend specific dietary changes, exercise routines, and regular screenings to help you stay ahead of the curve. If your wearable device detects irregular heart rhythms, it could alert you and your doctor to take action before a serious problem develops. The goal is to empower individuals to take control of their health, with AI as a trusted advisor and guide. It could alert you and your doctor to the earliest warning signs of a problem, enabling intervention long before you ever feel sick. This kind of early detection and intervention has the potential to prevent countless hospitalizations, reduce healthcare costs, and save lives. Imagine receiving a notification on your phone that prompts you to schedule a checkup, or having your doctor reach out proactively because your data suggests a potential issue. With AI, healthcare becomes more connected, more responsive, and more personalized than ever before.
This is the ultimate vision, a healthcare system where AI works silently in the background, acting as a personal health guardian for every single person. It is a world where technology and humanity work hand in hand, where every patient receives the right care at the right time, and where the focus is not just on treating disease, but on promoting lifelong health and well-being. The journey is just beginning, but the possibilities are limitless. As AI continues to evolve, so too will our ability to care for ourselves and each other, ushering in a new era of hope, healing, and human potential.
We have now sketched the outlines of a grand vision for the future of global health. It is a future where healthcare is affirmed as a universal human right, not a market commodity. It is a future where our focus shifts decisively from treating sickness to proactively promoting wellness through robust preventive care.
It is a future where mental health is finally brought out of the shadows and integrated fully into our definition of health.
And it is a future where technology and artificial intelligence act as powerful accelerators, helping us overcome old barriers and build systems that are more equitable, intelligent, and personalized than we ever thought possible.
This introduction has served to set the stage for a deeper exploration. We have established the why, the urgent moral, social, and economic imperatives that compel us to seek this transformation. The world is at a critical juncture, and the path we choose now will define the health and well-being of generations to come.
The challenges are significant, but the potential rewards are immeasurable: longer, healthier, and more fulfilling lives for billions of people around the globe.
The question is no longer whether we should pursue this vision, but how we can make it a reality for everyone, everywhere.
In the sections that follow, we will move from the why to the how. We will take a practical look at real-world examples of success. We will explore different models of universal healthcare that are already working in countries around the world, learning from their triumphs and their struggles.
We will delve into specific strategies for preventive care that have proven effective in reducing the burden of disease.
We will examine innovative approaches to integrating mental health services into primary care, breaking down stigma, and improving access.
This essay is intended to be more than just an academic exercise. It is a roadmap for change.
This journey is one of optimism and pragmatism. We must be inspired by the incredible possibilities that lie before us, but also grounded in the practical realities of implementing such profound change.
It will require political will, financial investment, and a fundamental shift in our collective mindset.
It will require collaboration across borders and disciplines.
By learning from the best examples, debating the most effective strategies, and harnessing the power of innovation, we can build a future where universal, preventive, and holistic healthcare is not just a distant dream, but the lived reality for all of humanity. Let us begin this important journey together with Peaceism Ecosystem.
Welcome to Healthcare for All, where we explore the future of universal healthcare and preventive care. Over the next hour, you'll hear from AI-generated experts sharing innovative models that aim to make healthcare accessible, affordable, and effective for everyone. Discover how preventive care can reduce costs and improve lives, and learn about the latest strategies to integrate mental health into our healthcare systems. After these inspiring presentations, join our AI-moderated debate to explore different frameworks for mental health integration, addressing challenges and opportunities. Together, let's envision a healthier, more equitable future for all. Universal health care is not a luxury. It is a human right. When we treat health as a privilege reserved for those who can pay, we divide societies into two realities: those who can heal and those who are left behind. But when we recognize health as a public good, we unlock an engine of social progress that benefits everyone. Look at the Nordic countries. Their universal healthcare systems are not perfect, but they ensure that a child born in a rural village has the same right to a doctor as a child born in a capital city. Rwanda, after the devastation of genocide, rebuilt its healthcare system around equity, and today, more than 90% of its citizens are covered. These examples prove that universal healthcare is possible, even in resource-constrained settings. And the impact goes far beyond medicine. Studies consistently show that universal healthcare strengthens economies. A healthy workforce is more productive. Fewer families fall into poverty due to medical bills. Communities become more resilient against crises, from pandemics to climate shocks. So the question is not, can we afford universal healthcare, but rather can we afford not to? Every delay, every year of inaction costs us lives, potential, and opportunities for human flourishing. But let's be clear. Universal healthcare is not a one-size-fits-all formula. Each country must design a model that fits its unique context, its culture, its resources, its people. Some may lean on public systems. Others may blend private and public partnerships. What matters is the principle that no one is denied care because of who they are or what they earn. Preventive care is the most powerful yet most underutilized tool in healthcare. Every dollar invested in prevention saves up to $5 in treatment. Think about that. A small investment in keeping people healthy spares families the devastating costs of hospital stays, lost wages, and chronic illness. Yet too often, our systems wait for disease to appear before they act. What if we flipped the script? Instead of waiting for heart disease, we invested in nutrition education and regular blood pressure screenings. Instead of focusing only on cancer treatment, we emphasized early detection through accessible screenings. Instead of treating diabetes once it has advanced, we built healthier food systems and promoted active lifestyles at the community level. The evidence is clear. Prevention transforms healthcare from reactive to proactive. It changes the very definition of what it means to be healthy. Health becomes not simply the absence of disease, but the presence of well-being. And prevention is not just about the individual. It's about systems and communities. When a city invests in clean air policies, it prevents asthma and lung disease for thousands. When schools prioritize physical activity and balanced meals, they lay the foundation for a healthier generation. When governments fund vaccination programs, they save millions of lives and billions of dollars. But prevention requires long-term vision and political courage, because the benefits of prevention are not always immediate. Politicians may not see the results in a single election cycle, yet the payoff for humanity is enormous. Imagine a healthcare system where illness is the exception, not the norm, a system that celebrates wellness as much as it responds to disease, a world where your local clinic isn't just a place you go when you're sick, but a hub for health promotion, education, and community connection. That is the power of prevention. Not just saving money, not just saving lives, but building societies where health is sustained, protected, and shared by all. Artificial intelligence is already reshaping healthcare. From predicting disease outbreaks to detecting the earliest signs of cancer, AI tools are democratizing access to life-saving insights. A rural clinic with limited staff can now use AI-driven diagnostics to catch diseases earlier than ever before. A smartphone app can track subtle changes in speech or movement, signaling neurological conditions before they advance. And global health agencies use AI to map and predict epidemics, buying precious time to save lives. But here's the truth. AI is not magic. It is not a cure-all. And it must never be allowed to replace the human touch at the heart of medicine. The key is balance. Technology must complement human care, not compete with it. Why? Because healthcare is not only about data, it is about trust. A machine can read a scan, but only a human doctor can hold your hand when you are afraid. An algorithm can flag a risk, but only a nurse can explain it with compassion and help you feel safe. If we design wisely, AI can take away the heavy burdens, the repetitive tasks, the administrative overload, the delays in diagnosis, freeing clinicians to do what they do best: care. Imagine doctors spending less time typing into computers and more time listening to their patients. Imagine health workers in underserved areas gaining the same decision support tools as those in the world's best hospitals. Of course, there are challenges: data privacy, bias in algorithms, unequal access to digital tools. If left unchecked, AI could widen inequalities instead of reducing them. That is why ethics and inclusivity must guide innovation at every step. Together, we can create smarter, more compassionate healthcare ecosystems. Systems where artificial intelligence strengthens human intelligence, where efficiency serves empathy, where technology is not the story, but the instrument that allows the story of human healing to unfold with more dignity and more reach than ever before. As a voice for patients, I want to remind us, behind every policy, every system, every budget decision is a person. Someone's mother, father, child. It's easy, when we talk about healthcare, to get lost in numbers, cost per capita, coverage percentages, mortality rates. These statistics are important, but they are not the whole story, because behind each number is a life. Behind every data point is a human being who dreams, struggles, and deserves dignity. Healthcare is not only about curing illness, it is about dignity, trust, and hope. It is about whether a young mother feels safe walking into a clinic, whether an elderly man can afford his medicine without choosing between food and treatment, whether a teenager struggling with depression finds someone who listens. I once heard a patient describe healthcare as a doorway. For some, that doorway is wide open, affordable, welcoming, easy to walk through. For others, the doorway is locked, blocked by cost, distance, or stigma. A true healthcare for all system ensures that the doorway is open to everyone, no matter who they are or where they come from. And here's the truth. Patients know what they need. Too often, systems are designed without listening to the very people they serve. If we want healthcare that works, we must design it not just for people, but with people. That means listening to patient voices in policy rooms, including communities in decisions about care, and respecting the lived experiences of those most affected. Because healthcare is not charity. It is not something given to the poor or marginalized. It is a partnership between systems and citizens, built on respect. A healthcare for all system listens to its people and ensures no one is left behind. Yes, mental health must be integrated. 1 in 4 people will face a mental health challenge in their lifetime. That is not a statistic about them. It is a statistic about us, our families, our neighbors, our colleagues, our friends. Yet for too long, mental health has lived in the shadows of healthcare, treated as optional, secondary, or somehow less urgent. By integrating mental health into primary care, we change that story. We reduce stigma by making mental health a normal, routine part of the healthcare journey. When a patient comes for a checkup, screening for depression should be as natural as checking blood pressure. When someone visits their local clinic, access to counseling or mental health support should be as expected as access to antibiotics. Integration improves access. In many countries, there are far too few psychiatrists, psychologists, or specialists, but primary care providers are everywhere, in community clinics, in local health centers, in the places people already go for help. Equipping them with tools, training, and resources to address mental health expands the reach of care exponentially. And most importantly, integration treats the whole person, body and mind, together. We know that mental health impacts physical health. Depression worsens outcomes for diabetes and heart disease. Stress weakens the immune system. Trauma affects recovery from illness. To separate the mind from the body is not only artificial, it is dangerous. Without integration, we continue to treat mental health as an afterthought instead of a fundamental part of health. The result? People suffer in silence. Families carry burdens alone. Economies lose billions in productivity. And lives are cut short, not by disease alone, but by despair. Imagine instead a system where mental health is not hidden in specialist clinics or whispered in shame, but welcomed openly at the very front door of healthcare. A system where seeking help for depression is as ordinary and as accepted as seeking help for the flu. Integration sounds ideal, but we must proceed cautiously. There is no question that mental health is essential. No one here would deny its importance. But the challenge lies not in recognizing the need. It lies in how we build systems that actually deliver care. Many healthcare systems around the world are already underfunded, understaffed, and overstretched. In some places, clinics lack enough doctors to handle even basic physical health needs. Nurses are working double shifts, supplies are short, and patients wait hours just to be seen. To add mental health to this already fragile system, without major new resources, risks overwhelming it even further. Integration without investment can dilute care quality for both physical and mental health. A general practitioner may be asked to diagnose and treat depression in the morning, manage diabetes in the afternoon, and handle emergencies in between. Often without the specialized training or time required, the result could be well-intentioned but ineffective care. Specialized systems, when properly funded and staffed, may serve patients better. Mental health requires expertise: psychiatrists, psychologists, social workers, community counselors. It requires environments where confidentiality, time, and trust are prioritized. Folding it into primary care without the right safeguards risks reducing complex issues into checklists, or worse, missing them altogether. And let's be honest, integration is not cost neutral. It demands investment in training, infrastructure, supervision, and ongoing support. Without that, we may raise expectations but fail to meet them, leaving patients disillusioned and providers burned out. So the real question is not whether mental health matters. It does. The question is whether integration is the most effective and sustainable path forward for every context. In some systems, the answer may be yes. In others, building strong, well-funded, specialized mental health services alongside primary care may be more realistic and effective.
Hi there, I'm Miss Sarah. Well, I guess you could call me Peaceism. Yeah, peace works. Let me show you something important. See these people? They're all struggling with healthcare. It's tough out there. But what if I told you there's a way to change all this? Enter World Peace Development Holdings Limited. They've got this amazing idea called the Peaceism ecosystem. It's all about bringing people together, you know? Healthcare for everyone. Watch this. See how everything's connecting? Now look, people are healthier, happier, and more peaceful. Cool, right? Want to be part of this change? Join us at the Healthcare for All Expo. Together, we're building a sustainable future. How's that for world peace? Remember, a healthy world is a peaceful world. See you soon.
Have you ever stopped to think about what being healthy truly means? For so long, many of us have viewed health as simply the absence of disease. We go about our busy lives, often ignoring the small whispers from our bodies, until one day those whispers become a shout. A diagnosis, a persistent pain, a feeling of complete burnout. We then rush to find a fix, a pill, a procedure to make the problem go away. But what if we could change this story? What if, instead of waiting to react to illness, we could proactively build a foundation of wellness that makes us more resilient, joyful, and full of life every single day? This is the very heart of a new and empowering movement in healthcare. This isn't about chasing perfection or following extreme restrictive diets. It is about a fundamental shift in our mindset. It's about moving from a reactive model of sick care to a proactive model of genuine healthcare. The exciting part is that you don't have to do this alone. In fact, the most powerful way to embrace this change is by connecting with others. Shifting our focus at its core, proactive health is a beautifully simple idea. It is about taking intentional actions to protect and enhance your well-being before you get sick. Think of your health like a garden. The reactive approach is to wait until the garden is overrun with weeds and pests, and then desperately try to salvage what's left. The proactive approach is to tend to the garden every day. You nurture the soil with good nutrients. You provide it with regular sunlight and water. You gently remove any small weeds before they have a chance to take over. This consistent, gentle care results in a garden that is vibrant, strong, and resilient. This shift from treatment to prevention is one of the most important things we can do for our long-term vitality. Proactive health looks at the whole person, not just a set of symptoms. Show diagram of 4 interconnected circles: food, movement, sleep, relaxation. What we eat, how we move, how we sleep, how we relax. It acknowledges these areas are interconnected. A poor night's sleep can lead to poor food choices the next day. Chronic stress can disrupt our sleep. A lack of movement can impact our mood and energy levels. By making small, positive adjustments in each area, we create an upward spiral of well-being. It's not about running a marathon tomorrow if you haven't run a mile in years. Choosing to take the stairs instead of the lift. Adding one extra portion of vegetables to your dinner plate. Switching off your phone an hour before bed to allow your mind to unwind. Now that we understand what proactive health is, let's talk about the network part. For centuries, we have known that humans are social creatures. We thrive on connection, community, a sense of belonging. A wellness network takes this fundamental human need and applies it to our health journey. It is a group of people who come together, either in person or online, with a shared intention of supporting one another. This support system transforms health from a lonely individual struggle into a shared, collaborative adventure. It provides accountability, encouragement, a space to share both challenges and successes. Think about how much easier it is to go for a walk when you have arranged to meet a friend. On a day when you feel tired or unmotivated, knowing someone is waiting for you can be the gentle nudge you need. This is the magic of a wellness network in action. These networks are not about professional medical advice. They are about peer-to-peer support. We are far more likely to stick with positive habits when we feel connected to others on the same path. This shared experience creates a powerful sense of camaraderie that can be incredibly motivating. The beauty of a wellness network is its diversity. It can take so many different forms to suit different personalities and needs. Weekly cooking club exploring healthy recipes together. Colleagues taking a mindful lunch break away from their desks. An online forum for new parents sharing tips on stress and sleep. A WhatsApp group where friends check in daily to share health wins. Ultimately, these networks help normalize healthy behaviors. When you are surrounded by people who prioritize well-being, it starts to feel natural and normal for you to do the same. If everyone around you orders sugary drinks and fast food, it can be hard to be the only one ordering water and a salad. But in a wellness network, making the healthier choice becomes the easy choice. This social reinforcement is incredibly powerful. It reshapes our environment and habits to feel supportive and inclusive rather than isolating or restrictive. For most of modern history, our healthcare system has been built on a reactive foundation. We wait for something to break, and then we try to fix it. If you get a chest infection, you get antibiotics. If you have high blood pressure, you are given medication to lower it. While this approach is essential for acute illnesses and emergencies, it is far less effective for the rising tide of chronic lifestyle-related diseases. Conditions like type 2 diabetes, heart disease, and many forms of mental health struggles often develop slowly, over decades of subtle imbalances. By the time a diagnosis is made, the root causes have become deeply entrenched. Imagine your health is like a boat. The reactive approach is to wait until the boat is full of water and starting to sink before you begin frantically bailing it out. It's stressful, exhausting, and you are always just one big wave away from disaster. The proactive approach involves regularly checking the boat for tiny leaks and patching them up as soon as you find them. You are not waiting for a crisis. Small, regular acts of maintenance keep the boat strong, dry, and sailing smoothly. This is a far more sensible and sustainable way to navigate the waters of life. Acting early, long before symptoms become severe, allows us to address the root causes of potential illness, not just the downstream effects. Instead of waiting for a diagnosis of type 2 diabetes, a proactive approach would focus on lifestyle factors that contribute to insulin resistance in the first place. Improving your diet to stabilize blood sugar. Incorporating regular movement to help your muscles use glucose more effectively. Managing stress, which can also impact blood sugar levels. By making these changes early on, you may be able to prevent the disease from ever developing, which is a far better outcome than managing it for the rest of your life. This preventative mindset leads to better long-term outcomes and dramatically improves quality of life. Living with a chronic illness often involves daily medication, frequent doctor's visits, and limitations. It can take a toll on your energy, mood, and finances. Investing proactively means more freedom, more energy, more joy. You know, the wonderful thing about proactive wellness networks is that they are often hiding in plain sight. Honestly, you do not need to look far to find them. They come in all shapes and sizes, catering to every interest and fitness level. One of the most common and accessible examples is a community fitness group. Think Park Run, a free event in local parks every Saturday morning. It brings together people of all ages, people walking, people jogging, runners hitting 5 kilometers. A yoga studio that fosters community. Neighbors meeting for a morning walk 3 times a week. These groups make movement social and fun. Online communities are powerful wellness networks. You can find a supportive group for almost any health goal. Facebook groups for whole food diets, recipe shares, practical tips, and encouragement. Apps like Strava help runners and cyclists cheer each other on. Online mental health forums offer anonymous support. These digital tribes can be a lifeline for those who feel isolated. Workplace wellness initiatives, lunchtime meditation sessions, subsidized gym memberships, step challenge leaderboards, boost physical and mental health, build team bonds, and shift culture into support. Informal social clubs, a hiking group on local trails, a healthy cooking club, a book club focused on health. These networks weave health into our social lives, making it a natural and enjoyable way to connect. When you join or create a proactive health network, the benefits extend far beyond the purely physical. Yes, you may see improvements in weight, blood pressure, and energy levels. But the ripple effect enhances overall happiness and well-being. Connection and camaraderie act as an antidote to loneliness and isolation. Feeling part of a community and sharing a goal can boost mood and self-esteem. A single word of encouragement can turn a difficult day around. Regular positive social interactions reduce stress, anxiety, and feelings of depression. Group exercise gives you endorphins from activity, plus oxytocin from social bonding. That combination equals greater happiness. Being part of a network increases purpose and motivation. Committing to show up, a weekly walk, a daily check-in, creates grounding routine. Accountability keeps you on track when motivation wanes. Seeing others' progress fuels belief that change is possible. That positive feedback loop builds momentum. These networks strengthen community ties. Neighborhoods and workplaces improve. Prioritizing wellness together creates a stronger, kinder, more vibrant society. The idea of starting your own wellness network might sound intimidating, but it can be one of the most rewarding things you ever do. The key is to start small and keep it simple. You do not need a formal structure, a fancy name, or a complicated agenda. All you need is a clear intention and one or two other people to join you. Think about an activity that brings you joy and fits easily into your life. Being in nature or learning to cook healthier meals. Choose something you are genuinely excited about. Once you have an idea, reach out and invite others. Your partner, a close friend, a family member, a colleague. Keep it low pressure and focus on connection and shared fun. I'm thinking of starting a weekly walk around the local park on Saturday mornings. Or, I'm creating a WhatsApp group to share simple, quick recipes. Decide simple logistics and remove barriers. Don't worry about perfection. The most important thing is to get started. Your small circle can evolve organically. What begins as a walking group might try a yoga class together or organize a healthy potluck dinner. Remember, focus on encouragement, not competition. Create a culture where everyone can share wins and struggles without judgment. Celebrate small victories, choosing a healthy snack, getting an extra hour of sleep. Offer support, not criticism. The strength of your network comes from kindness and consistency. If starting your own network doesn't feel right, there are many welcoming communities to join, right in your local area and online. Check local notice boards and council websites for walking groups, dance classes, Tai Chi in the park, allotment societies, and more. Explore hobbies, running clubs, park run, meditation groups, cooking classes, college workshops, and health food shop sessions. The digital world is vast. Facebook groups for intermittent fasting or wild swimming, and sites like Meetup to find hiking, yoga, wellness, or healthy eating near you. Try a few groups to find the right vibe. When you find a potential group, take the first step and reach out or show up. Every member was new once. Email the organizer, introduce yourself, ask questions, or just be brave and drop in. Go with a curious, open mind. Listen, get to know people. You might not find the perfect fit immediately, and that's okay. The journey is part of the adventure. We have journeyed through proactive health and the power of networks. It's not about grand changes, but small, consistent steps. Water in the morning, a 5-minute lunch walk, calling a friend. Repeated day after day, they compound into transformation. A more resilient body, a calmer mind, and a more connected.
Brothers and sisters of Earth, today, I stand before you not as a leader, not as a prophet, but as a humble servant of humanity. I speak to you from the depths of my soul, with a message that transcends borders, religions, races, and species. This message is not mine alone, it belongs to all of us, for we are all children of the same origin, descendants of Adam and Eve, bound by the same breath of life. From the moment the first star ignited in the cosmos, to the birth of our planet, to the emergence of life, and finally to the rise of humanity, The universe has been weaving a story of unity, yet somewhere along the way, we forgot this truth. We divided ourselves into nations, tribes, and ideologies. We built walls instead of bridges, waged wars instead of peace, and sought power instead of love. But today I call upon you to remember, we are one. The time for peaceism has come. Peaceism is blessing and guidance for all. It is a way of life. It is the recognition that every living being, human, animal, plant, and even the earth itself, is interconnected. Peaceism teaches us that harming another is harming ourselves, that loving another is loving ourselves, and that healing the world begins with healing our own hearts. Under the peaceism ecosystem, we will honor the sanctity of life, embrace diversity, live in harmony with nature, pray to Lord of the world. Let us pray, O our Creator. We humbly acknowledge you as the source of all that is, the architect of the universe, and the sustainer of all life. Let us pray for wisdom, compassion, and unity, and let our prayers be actions that uplift the world. Dear Lord of the world, known by many greatest names, we come before you as one family, one heart, one soul. Guide us to see the light within each other. Teach us to forgive, to love, and to serve. Help us to heal the wounds of the past and build a future of peace. May our hands work together, our voices sing together, and our spirits rise together, for we are your servant, and in you, we are one. Amen, Amin, Shalom, Om Shanti Ash, and so it is. This is not just a dream, it is a calling. Each of us has a role to play in this great awakening. Whether you are a teacher, a farmer, a scientist, an artist, or a leader, your contribution matters. Let us educate the next generation in the ways of peace and unity. Create systems that uplift the poor, heal the sick, and protect the vulnerable. Innovate technologies that serve humanity and the planet, not destroy them. Spread love in every word, every action, and every thought. If this message ignites a fire within you, if it stirs your soul and compels you to act, then let us carry it forward together. O Lord of the world, we thank you for the beauty of the world, the wonder of nature, and the precious gift of life. We are grateful for the sun, the moon, the stars, and the vibrant tapestry of creation. Let us strive not just for the Nobel Peace Prize, but to touch the hearts of all beings, from the tiniest ant to the grandest whale, from the deepest ocean to the highest peak. The time has come to transcend our differences and embrace our shared humanity. The time has come to heal the scars of the past and forge a future brimming with hope. O Creator, bless us with peace, joy, and purpose, and grant us the strength to overcome challenges and to persevere in your service. We are one. We are peace. We are the change. Thank you, and may the light of unity guide us all. We pray in the name of the Creator, the source of all things. Amen.